Good morning. Has everyone had a good break? It's good to have time off from school because you had a very hectic semester last semester. So we're ready to get you going for this semester. One of the things that I want to kind of congratulate you as a class on is the fact that you raised, we know, at least 3,000 for St. Jude's. So, you can give yourselves a round of applause for all of the support that you have given for that very important cause. So we're going to have final numbers for you in the next few weeks, but that was a very impressive thing that you did, and so we do want to thank you for that. In thinking about that, there are a couple of service learning opportunities that are coming up very quickly in January with Capital Day as well as the Nursing Summit. And they'll be talking to you in one of your courses about that opportunity that is coming up. We are videotaping this session of our orientation. It will be posted for you so that you can access your orientation throughout the semester, and that's going to be very helpful for you. Hopefully, if you come up with a question, you need to go back and review something, so that will be available for you. All right. Am I blaring? Okay, let me know if I'm knocking you out. One of the things that I'm going to do a very quick informational thing, and then we're going to go directly through your courses. But one of our big issues last semester was communication. So let me ask you a question. By your policy, how often are you supposed to be in your courses checking messages and announcements? Every 24 hours, okay? What has happened is a lot of you have missed information because you're not checking those courses routinely. So again, I want to really encourage you to follow that. How many courses are you going to have this semester? You've got 3 courses. And the fourth thing you should check on that 24-hour basis is your RN to BSN Resource Center, because program announcements that affect everything will be coming through the RN to BSN Resource Center. So every 24 hours, you ought to do a quick check-in to 459, 465, 467, and RN to BSN Resource Center. Remember, when you check those courses, to go to your message tab and check your messages, because that's the way the faculty are going to communicate with you primarily. Now, on another communication issue, also check your MUW email. That's another possibility. But the email address that you listed when you applied to the university on your MUW application is the way that DJ is communicating with you from the office. So if you've had a change in that email address, or you're not checking that one, you do need to check that, or let DJ know what that new email address is so that she can update that in her records. Let's see. Another request related to communication does come from the office, because we have lots and lots of phone calls coming in through the office. If when you call, you will immediately identify yourself by name. I'm Carol Van Zant, and I am a current student in the RN to BSN program. That really helps our office staff in being able to direct your call quickly, because we have so many students that are looking for information, or they're pre-BSN students. So identify yourself as far as the there we go. For those of you watching, we just had a quick technical difficulty. We're good again. All right. Another housekeeping thing, if you have changed your name, you need to not only go through the registrar's office on the Columbus campus in terms of making that official change, but be sure and call our office as well, because we need to update that so that when we're looking for information related to your records, we can quickly find that. All right. The other thing to be aware of is this is the semester that you will apply for graduation. If you will be graduating in August, in August, then you're going to apply for graduation this semester. We have put a date on the March calendar for you to begin that. But in order for the registrar to have plenty of time to do your degree audit, if you can apply early in March, that will be helpful. So that if there is anything that's showing up lacking, you would have time in that summer semester to get that completed. All right. Anybody from faculty have anything else I should talk to them about generally? All right. We're going to now have the Dean of Students, Serena Cantrell, to come and talk with you about Title IX, and then we'll move right into our courses with 465 first. Serena.
Good morning. I had a little trouble finding the building, but it's a very impressive place you have here. Like she said, my name is Serena Cantrell. I'm the Dean of Students at the W Campus in Columbus. And so I oversee housing and residence life, campus recreation, international student services. But I also manage our behavioral intervention team, and I'm also the Title IX coordinator for the university. I do have a PowerPoint. Look at that. I don't think my font is going to be, you know how you use fun fonts and you think it's cool, and then when you get somewhere, it doesn't look correctly. So please bear with me if mine is a little off. But what I told her about 10 minutes, just talk to you about what Title IX is, what that means for you as a member of the W community. We have a new website on our MUW website you can go through, and then I've also got a handout I'll leave with you, and then I also have my ID cards, so you can have my contact information if you ever have any issues in the future. So how many of you know what Title IX is? Anybody in the room know what that means? It's a little early, isn't it, for me to ask questions? I hope you liven up for the rest of the day. Title IX is the Education Amendment Act of 1972. What it does, it prohibits sexual discrimination in all educational programs and activities. A lot of times we think of athletics when we think of Title IX, but it also means for you that you have the right to be free from discrimination within the W campus, whether that's sexual harassment, sexual violence, even domestic or dating violence within the education atmosphere here. So it says no person in the U.S. shall on the basis of sex be excluded from anything. And so we want everybody to feel welcomed here and have no harassment issues, and that's why I'm here today, to put a face with a name so you know who you can contact if you do have issues in your program here at MUW. Like I said, Title IX encompasses a lot of things now. I don't know if you've seen the news with all the colleges that are being investigated for Title IX and how they've handled investigations. And so it encompasses not only sexual discrimination, but it also includes dating violence now, domestic violence. So anything that falls under those umbrellas falls under Title IX for us. We have a new policy in place, and the W is taking it very seriously. I've had several investigations in the fall, and we want people to continue to report any issues they're having in this area so we can do a full investigation and make sure that you're being treated fairly. So we want an atmosphere that all members of the community is respected and free to communicate and free to report things when you feel if something's not right and you're being harassed in any way. As a member of the community, we are required to report things, and so we ask that you report to myself, and I'm going to show you how you can do that so you're aware of the process and the reporting online. But this includes all of us. It includes chairs, faculties, students. All of us are required to report if you see something, and my motto is see something, say something. And if we ask that you be a bystander, if you see something that's not right that involves Title IX or harassment, discrimination, sexual harassment, sexual assault, anything like that, please report that to us and know that I am the person that you would report to. So if you're emailing me, you can see who I am today and then remember, oh, that's the lady that came and talked to us in orientation while you're in the program for the next couple semesters. Online, you can go to the MUW website and just type in Title IX to the search bar, and it will take you to our new Title IX page. On this page, you'll find Sexual Misconduct Policy, which is the policy. It's this couple pages long. And so it just talks about what Title IX really means for you as a student, what are your rights as a student, and how to report a Title IX issue. It also has a reporting form on there. It asks you questions about the incident to give us more information. And then what happens with that report is it comes to myself, and then I'll reach out to you to see if you'd be willing to talk with me about that and allow me to do an investigation on that situation. On our campus at the W, I am one person and cannot do it all. So I have Title IX deputies who are faculty across the MUW campus that would help me with investigations if we're having several investigations going on at one time. And so these Title IX deputies are listed on the webpage. You can see who they are. We do have one from the nursing program at the W, and so that might be someone I call on to help me investigate something here. And there's about 9 of them, and so you can kind of go out there and see who those are directly. If you're in a situation and you're not quite sure what to do, we have a resource page. It's called Get Help Now. It kind of explains, and you all know as nurses, sexual assaults and sexual violence is a difficult thing to go through, especially as a victim. And so we have a Help Now page just explaining the process of what you should do if something has happened to you, some recommendations about going to your local hospital, doing the rape kit and all of that. That's on that page for benefit for students if they're going through something in the middle of the night and there's not someone they can call, they can go to this page. We also have a page, it's called How to Help a Friend. So if your friend talks to you and says, hey, I think I might have been sexually assaulted last night, but I'm not sure, and you kind of don't sure. We talk about this with a lot of freshmen, and so they're kind of not sure how to talk to their friend. As nurses, you probably know how to have those conversations, but for younger students, they're not quite sure how to handle a friend that comes in and says, hey, I think I might have been sexually assaulted last night. This page is a guidance for you if you're talking with a friend or whoever that might be, class member. This can be a page that you can retreat to, and it can walk you through steps, remaining calm, being support systems on campus for students, and all of that. Prevention and protection is mainly tips about when you're out and about or how to handle someone who is being inappropriate with you. Those are some tips. And we also have a lot of programming going on at the W campus. So if you're interested in any programming on Title IX or sexual assault, sexual violence, you can find those there. We update that when we have like big speakers coming to campus or any webinars we're doing or anything like that. We also have a resources page on this website, just your local shelters, local hospitals. Our counseling center at the W is there, and our health center's there, and so there's just a list of resources for students there. Not used to that? Okay, so I have a handout that you guys could have. That way you remember the Title IX. I'll just leave it on your back table. They can pick it up when they leave. I brought plenty. It's got my contact information on it. And know that your conversations with myself and deputies are kept as confidential as we can. We do have to report just numbers of Title IX incidents, but we don't have to report really details about the case or anything. And we do keep the investigations very confidential. And I do want you to know that the W is taking a very big stance on this about why students need to be treated fairly, faculty need to be treated fairly. Title IX involves everybody. It's not just students. It does involve faculty also if you're being harassed in your workplace. Any questions about this process or Title IX? Okay. Well, thank you for letting me come for a few minutes. I guess I'll go to work. I know, right? And I'll leave my business cards and the handout for you all.
Thank you.
You're very welcome. No problem.
I thank her for coming, don't y'all? Okay, my name is Dana Walker, and this semester I'm going to be guiding you through the NU 465, and that's our community course. Hannah's got it pulled up there. Okay. One of the things I want to ask you, how many of you printed off your course overview last night? Raise your hand high. How many of you intend to print it off this semester? How many of you have never printed off your course overview? Go ahead and tell it. We have one. I know there's people out there. Okay, here's a word of advice. Go home tonight and print off the course overview, because that's going to give you, that's kind of like your roadmap to help you get through this semester in NU 465. And a lot of times you have questions and you'll call and you'll think, well, here's my favorite phone call.
I'm calling to ask about this course, and I'm like, okay, which course is it? I don't know. I'm like, well, who's the course coordinator? Well, I don't know. Well, guess where you can find that? On the course overview. And actually, in this semester, we have put an announcement. And one of the things I want you to do, and I'm too loud to be talking in this, but right now, do all of you have your cell phones? I know you do. Get your cell phone out. Remember, we are in the winter months, and I remember last year there were students that were panicking because they were at work for 3 days, spending the night, because they were iced in and snowed in, and they didn't know how to get in touch with us because they couldn't get on the internet. They had their cell phone, but they didn't have our number. So right now, program in that MUW Tupelo 662 620 5380. MUW Tupelo. So when y'all get snowed in February, because I am doing a snow dance, you've got the number. And you're going to call and you're going to say, DJ's going to answer the phone, and you're going to say, I need to report to somebody that I'm at work for the next 3 days. And that way, it'll take away some of the stress for you because you have contacted us. Because when assignments are coming due, what does the course syllabus say about assignments? If you need an extension, you've got to call before the deadline. And life is going to happen, y'all. Life is going to happen this whole semester. It may not be snow. It may be some personal issues. But if you don't know how to get in contact with us, that's going to add stress. So I want you to have that number and be proactive, okay? So did everybody put that in their phone? I see you out there putting it in there. That's how you're going to contact us before you get into trouble. Okay. Do you care to open up the course overview? And y'all watch her where she finds it. It's under information. And there it is, course overview. Everybody's going to print that off tonight and make them a notebook. Here's another thing I want you to do. How many of you made notebooks for your classes last semester? Okay. I still see, there is somebody out there that hasn't raised their hand a time. They just keep saying, no, I didn't do that. I know that all of you are very computer savvy. But has your computer or your internet ever gone down? Yeah, mine has too. And I can tell you, I was a procrastinator in school. My assignments were due at midnight on Sunday night. I had no problems with that because I could write a paper in an afternoon. Well, guess what? My neighbor, who is a pharmacist, got out and decided he was going to cut a tree down one Sunday night. Well, guess whose power line it hit on? It hit on mine. Do you think I was in a panic? Absolutely. And I was like, y'all, I didn't know anybody's number. So I didn't know who to get in touch with. Of course, I could go to the library. But don't procrastinate and have your notebook made. Here's what I want you to do. Get you a notebook and get 8 tabs. You're going to put in your overview. You're going to put in your calendar. And then the other 6 tabs are going to be like your assignment tabs. And get yourself organized from the beginning, and it takes away a lot of the stress because y'all live stressful lives. You have full-time jobs, and you're either a wife, a mother, a daughter, a son. You know, you have other responsibilities, so get yourself organized. So I want you to have a notebook, and I want you to have 8 tabs in it. Y'all got that? Okay, we're going to go through the overview. And if you see, Penny Finch, will you stand up? She's going to be the co-coordinator for this class. And there's Penny. So if you have any questions, call Penny. No, you can call either one of us. But I may say, I don't know, I got to go ask somebody now. But there, in the faculty, we have all the faculty listed in there because we are a community course. But don't be disfinding somebody because you like their name. If you have a question about NU 465, you call Dana Walker or you call Penny Finch. And in a minute, you're going to meet Hannah Bascom that's got an assignment in here. You're going to call one of us, and Terry Todd is helping us in this course a lot. Don't be calling the research faculty, and don't be calling the leadership faculty. Call one of us to help. And we may have to go get one of them to help us answer a question, but we'll do that, okay? Because they're answering questions about their course. And then you can read the course description, your textbook. Does everybody have this textbook, Stanhope? Your assignments, you're going to get a lot of your information out of here from the chapters. And there's also going to be a lot of web links that we're going to direct you to look up information. So use those web links. But remember your textbook. And when you get to your first assignment in perspectives, this textbook is going to be your friend. Okay? Okay, go down, Hannah, just a little bit. Sigma Theta Tau is in this, again, I know we have one new student here today, and you're going to come up and let me set up your ATI account. The rest of you have ATI account. Let me ask you this. We put ATI out there for y'all to complete during the Christmas break in the RN to BSN. Who all has that completed? I know who you are because a lot of you already uploaded that certificate and you already have those assignments completed. I looked last night just to see. And so thank you. You've got that done. With the ATI assignments, whenever you upload your certificate, if you will look in the information tab or the content notes tab, I've put it a folder in there called ATI, and it has how to download or a certificate. So if you have problems, refer to that. Some of you have MacBooks and you have problems converting that over, and I don't know how to help you with the MacBook. I've tried to figure it out, but I'm not good at MacBooks, so you may have to call the ATI to get that to figure it out. But I would think a PDF file, as long as you've got your PDF on your computer, that you would be able to do that. But otherwise, you're going to download that certificate onto your computer and then upload it into the gradebook. Do y'all use those certificates in your place of work? I hope so, because you're getting CEUs from that, and your workplace likes for you to get continuing education, so use those. And once you complete 70 hours, you're going to send ATI an email, and they're going to email you a nurse manager certificate. I did it last year just to see, and they really do, and it's really nice. And I'm going to give mine to Carol. Sometime when I'm in trouble, I'm going to give her that and see if I can get out. But remember to use those, because when you're in this program, we're trying to advance your knowledge, to advance your career. Okay? So use the tools that we put in. In ATI, I talked to a group. Y'all, I've been a student my whole life, and I know there are times when you just do things to check it off your list. Well, there were times that I wished I hadn't just checked it off my list, because then I'm having to go back now and try to retrieve some of that information that I might not have paid as much attention to because I was 18 and 19 as a student. But with the ATI, those modules have a wealth of information in them. And I can tell you some of the comments I've had from past students. Miss Walker, I had to write a business plan, and I remembered one of those modules, and she wanted to know which one it was. And I said, well, look in this one. Because after you graduate, you're going to still have access to the ATI. And she went in and she wrote her business plan because that information taught her how. And so y'all use that. Some of you are just going in and taking the quiz, and I applaud you for having that knowledge base. But I can tell you the module is very interactive, and it will help you. It will help you in your career. It will help you advance, and that's what we want you to do. The first assignment, when was first assignment due in U465? When is the first one? Friday, ATI? Does everybody know that? You have an ATI assignment that's due Friday. I know that probably in the next 2 days I'm going to get about 125 phone calls that they didn't write down their password, or I don't know how to log into ATI. If you don't remember your username and password, call me and I'll help you out, okay? But you have project management that's due Friday. And then your next assignment is due next Wednesday. That's making me tired. And that assignment is called Perspectives in Community Health. And whenever, have y'all figured out these overviews yet? For the ones of you who have printed them off, I know several of you have never printed one off. But if you will look, you go through the entire course overview, and it tells you how to communicate about if you have disabilities, if you have, it tells you about the service learning, the Sigma Theta Tau. It tells you about academic dishonesty and plagiarism, student attendance. But then it's got the conceptual. That's scary that Miss Bascom knows where I'm going with this. That's scaring me, Hannah. Look at your conceptual outline, because all the time I have students call and they say, Miss Walker, I don't know where to find that information. Well, if you will look at your conceptual outline, it's got a whole lot of words on it, but look under required activities. If you were going to work on Perspectives in Community Health, what chapters in this book do you think that assignment's going to come from? Well, it says you got to read chapters 9, 10, 12, 13, and 14. And y'all are thinking, huh? I read them 2 nights ago. Because I was thinking to myself, this seems like a lot of work, and I don't want y'all to do something that I'm not willing to do, so guess what I did? I sat down and read those chapters. You can do it. You can do it in a night. When you're reading nursing books, don't read them like you're reading a Harlequin romance. When you're reading your nursing books, open the chapter and get a clue about what's important in that chapter. What do you think are some hints in a nursing book about what's important? If they put it in a table, they're trying to get you to pay attention to it. If they put, if they put it in color, it means that information is important. So y'all open the books up and look at those. And then when you start reading, your brain is going to be functioned then to think. It's going to start asking questions, because you're going to see the intervention wheel. And if you're like me, you're thinking, what in the world is an intervention wheel? Well, your brain, while it's thinking that, when you're reading about the intervention wheel, then it's in that mode to answer those questions. So you're going to comprehend and remember a lot more. So when you open up Perspectives, and it says this comes from Chapter 9, look at Chapter 9 and start looking at the wording and start looking at the headings and read it that way, and that'll help you. And then to evaluate, we have to evaluate you. So we got to put an assignment in there that you get a grade. Well, on this one, there's a lot of matching, but then there's some like case study type work in there. And we put Ebola. Have any of you heard the word Ebola in the last few months? So, we tried to put something that maybe is of interest, and I'm sure all of y'all have been to an in-service at your workplace about Ebola. So use it. Use that information to help you with this assignment, okay? Alrighty. Each assignment, look at that conceptual teaching outline. And here's what I want you to do. If you see a mistake on that, because I'm human, I've read that thing 25 times, and the other day I was looking through it, and I'm like, I have no idea what that means. So I was typing something that should have gone somewhere else. If you see mistakes or if you think it don't make a bit of sense, shoot me a message. Because somebody else probably has that same question. And y'all, if you will communicate with me in Blackboard in the Message Center, not in the research class or in the leadership class, where am I going to be every day in NU 465? So if you shoot me a message in one of those other classes, I'm probably not going to see it. Unless I'm just being nosy and going in there and seeing if Miss Markle's really working. So shoot me a message here, and I promise I'll get back to you. And then we have it documented. And you're going to think, what'd she say about that? If you call me on the phone, you're not going to remember. But if you make me write it down, I'm responsible for what I said, and you're responsible for what you said. So let's communicate in the Message Center. Don't hesitate to pick up your phone and call me to ask a question, because that's what I'm here for. But send me a message if it's something that you don't need an immediate answer. Okay, family as a client, I'm going to let Miss Bascom come and talk to you about that, because that's an assignment that she has worked diligently on. And y'all are going to be doing genograms, echo maps, all that stuff. Can anybody spell that? Well, Miss Bascom can, and I'm going to let her come out and talk about that. And then we'll go over some community stuff really quick.
Hello, hello. I know y'all are so excited. You're learning about what you're going to be doing this semester, and you're thinking, here we go. I got to get through this again, right? It's going to be easier, okay? I really think you're going to find with just the 3 courses, and now that you've gotten in the swing of things and you're going to get organized, that you're really going to get through this semester a lot easier. And then guess what? You've just got the summer left, right? So you've got something to look forward to. I'm going to talk to you a little bit about the family assessment assignment. This is not a new assignment. This is the same assignment that we've had in this course. We just reworked it so that maybe it will present a little bit easier to understand. The first part that we've set up is we've titled theory, and that's where we're teaching you the information. So even though you're not in the classroom getting those lectures, when you follow this guide and look through your book to get these answers, that's where you're really learning the content. You're learning definitions. You're learning what we're talking about, okay? So you're just going to go through and answer these questions. If it says to discuss or explain, do try to actually elaborate on your answers and put those answers in your own words. Don't just quote directly from the book. We all own a textbook and we've read it. We don't want to read it 400 more times, okay? And then if you'll just go on down, the application part. Now that's what's really important to you as a nurse. We don't try to build these courses, contrary to popular belief, just to give you busy work and have you have something to do, okay? We try to actually make these applicable to nursing and to you. So what we want you to do is learn what is a family assessment and why is it important to me. Even if you are not a community nurse, you are going to do a family assessment on yourself and on your family so that you can learn, what am I at risk for and what changes do I need to make in my lifestyle so that maybe I don't develop heart disease or diabetes, okay? So this is going to give you the framework that you need to complete that family assessment. And you're just going to go through using your book as a guideline to answer these questions. And when you get a little further, I've provided you with a family history of a sample family. And this is just a made-up family. It gives you all the information you need, the family members' initials, their gender, their relationship to one another, their place and date of birth, if they're married or divorced, and any health problems they have. And if you'll scroll on down, I've provided you with an already created sample genogram. Now, don't let this intimidate you. We are trying to get you to learn how to use different programs in the computer, and that way, with this being an online class, you can send that back into us electronically, and we don't have to deal with actual paper being faxed in and things like that. So I've provided you with this framework, and then I'm going to create a little video so that if you don't know how to edit this, I'm going to show you how. So if you need to change that to a circle for a girl or a square for a boy, or if you need to change the color, or when you need to type your information in there, I'm going to provide a little video of how to do all that, okay? But I've already set it up for you so you don't have to worry about actually creating it. You just need to go in and edit it. And you're going to first follow that information that I gave in the table about that family to create this genogram, so that way when we're grading it, we know you actually know how to create a genogram. And then the next assignment, portion of this assignment, is where you're going to create your own genogram for your own family. And when you're doing a genogram on a patient, you want to know what that patient is at risk for. So you want to go back. So typically we do at least 3 generations, and we go back. So for yourself, you want to do your parents and your grandparents, because you want to know what you're looking at for yourself, okay? And then you're actually going to upload that one into your discussion board. So you're going to look at it to answer the rest of the questions on this assignment, but you're going to upload it into the discussion board. Okay? And then the rest of that is just answering information. What did you identify from this? What did you find? Are you at risk for anything? And then you're going to create a little handout or a teaching points for if you were needing to teach this to your other family members, what they're at risk for, what they need to modify in their life to be healthier, okay? You just need to save this on your computer, and please save as you're working on it, especially if you're not really, computer savvy and you think you're going to have trouble with this genogram. Work on it for 15, 30 minutes, save it. Work on it for 15, 30 minutes, save it. Because if you're really struggling with this and you've worked on it for 2 hours and then your computer dies and it loses your paper, you're going to be distraught over that. So make sure you're saving it as you're working on it. And then if you go down a little bit further, there's something called an echo map. And if you don't know what that is, you're going to learn about that in the theory portion. And then there's a sample of it in your book, and then you're going to change and edit this already pre-made template to be applicable to answer the question. And like I said, if that intimidates you, I'm going to put a little video on there explaining how to edit it, so you can just go step by step, click, and edit, okay? And then go down a little more. Let's see. That's just answering questions about what you identified. And just a little further, let's see if there's anything else I need to speak to. Care plan. How many of you guys just love hearing that word? You thought, I'm never going to have to do another one of those, right? Well, wrong. If you haven't already noticed, in your practice with the electronic medical records, it's making you create care plans. And unfortunately, we get into the habit of just click, click, click. Every patient has the same thing. And we forget that this is actually applicable. This is actually important information that could tell me how I can be more involved in my patient's care and how I could be making a difference patient by patient. So using this with the community health and looking at your family assessment, you're going to identify your priority nursing diagnosis and create a care plan around that. Okay? And that's the assignment in a nutshell. Like I said, I'm going to post that little video, and feel free to email me or call me if you have questions once you start doing the assignment. The biggest thing is just not to be intimidated by the diagrams and things, and make sure that you have looked through your book and read the information before you call me with a question. I don't mind answering any question. There's no stupid question, but I do appreciate it if you've at least worked diligently to try and find it on your own. You know, I don't want you to call me and say, I haven't looked at this assignment, but I'm just overwhelmed because of this diagram, and I just need you to tell me what to do. You know, I do want you to attempt and find the information in your book first, okay? Is that it? All right, I'm going to give you back to Miss Walker.
Okay, those diagrams scared me. What about you? She's going to teach you how to do that in her video. We cannot let Miss Vincent be the YouTube video queen. Did y'all enjoy her messages this year? Sometimes y'all would call me with a question and I thought, what in the world are you asking me? So guess what? I would go watch the video. How many of you did not watch the videos? I mean, really, I know there's somebody in here. I know who it is, too, because I see her laughing. Y'all, those videos are a wealth of information in the RN to BSN resource. She put those out there weekly. And so we know that we have several different learning styles in this room, and so we're going to try different things this semester and different ways to teach so that maybe we can help you with your different learning styles. Okay, this is a community class, and I know y'all love to work in groups. Well, you're going to get that opportunity to work in groups this semester in the community course. And you're going to be groups of 10 to 15, and you're going to do a community assessment. And that assignment is community as a client. And you can see the chapters that you'll need to be reading in Stanhope. It's chapters 18 through 26 has information. You're going to go into your assigned community, and all of you are not local, and maybe some of you will not live in the community in which you're assessing, but you'll be able to do a lot of work on the internet and gathering data and information about your community. And all the time we have people, this person never got back to me. One of the things that when we send out your community groups, I'm going to send it out as a group message. And so when you reply all to that, you'll reply to me and to all of those students in that group. And that way I can see, if you will go through the Blackboard message board to communicate, I can see how many times you've tried to communicate with them. But y'all are going to be able to use your cell phones. You're going to be able to use Skype, FaceTime, and different technology to be able to communicate with each other whenever you need to do face-to-face. The ones of you who live all in the same little community, maybe you can get together and have coffee and work on your project. But everybody will not have that opportunity. So know that there's other ways. Use Skype, use FaceTime. There may be other things that you can teach me about. If you know ways to do community groups and meetings without having to be in the same room, share them with us and we'll share them with the rest of your class. But this assignment is going to be your assessment, and then as a group of 10 to 15, you are going to complete a formal paper, and that's what you will turn in. That will be one person in the group will be responsible for uploading it. Each individual student will have to do a discussion board on this community project because we want to know what you learned as an individual, and you will be getting clinical hours for this project, each one of you as an individual. So individually you will have to respond to a discussion board. Okay, so the paper is an individual or a group paper. It's a group paper. The discussion board is an individual or a group discussion. Individual, exactly. And I have put you some just writing tips. I know that last semester y'all learned how to write in the, what was the course y'all learned how to write? Scholarly writing course. And so I know you've got that down, so that's what you're going to use those skills from last semester to complete the paper. And then after you get through with that assignment, you're going to be able to implement that. Because in your community assessment, you're going to identify needs in your community. Can any of you just think about in the community where you live, can you think about a need you already are aware of? Does anybody in your community have childhood obesity problems? Drug problems? Yeah. What about, there's like areas where there's a poverty with children and maybe access to care, heart disease. When she was talking about the family assessment, it reminded me that that was a long time ago, 20-something years ago, when I was doing my family assessment. I was a late in life baby, so my father was dead when I was very young, so I didn't know a lot of his family. But when I started doing the family assessment, I realized everybody for generations died in their 50s with a heart attack. Well, I pretty much had my lifestyle was pretty set with my eating habits. I made a few changes and did, but I knew that I could impact my family by how I taught my children. So I had the 5-year-olds that would eat salad and baked potatoes instead of the French fries and other things, because I realized that pattern, something had to happen. So you may identify those things in your family. It may be heart disease, it may be cancer, or other things. But in your community, and y'all, as a nurse, you are a leader in your community. You can make things happen. And how do you think that you can make people change their lifestyles? With education, right? So you're going to get out in your community, and this time you're not going to do a PowerPoint. You're going to do a poster presentation, and you're going to present that to a community group. It can be a volunteer fire department. It can be at your church. It can be in a school. If you're teaching children that they need to exercise, you can go to your Sunday school classes, your schools. But you're going to go and you're going to present that community plan, and you're going to implement it by presenting and educating a group. For each of these communities, you're going to have a faculty mentor that you'll be assigned to, and they will help you with identifying places that people in the community that you can get information from, and they'll help you identify a community group that you can present to. And some of us will even be at your community presentation. We're going to randomly go to some of them that we can. One of the things that we will do this semester, if we'll set up a day, I'm going to make you a timeline for this community implementation project. And one of the things that we will do, if you're having trouble with your poster presentation and how to develop that, we'll have a work session here one day where you can bring your poster and you can bring your slides. And in your poster presentation, I said you don't have to do a 25 PowerPoint slideshow, but you'll make your slides through PowerPoint to put on your board. And so you can bring your stuff here one day, and we will help you with your developing that or putting that together if you're having trouble, or we will show you an example of how to put a poster presentation together. Can you think of anything else on that, Hannah? Okay. And then your last assignment is vulnerable populations. And that assignment you're going to do with your same group as you do your community assessment and your community implementation. And with that vulnerable population, in the first part of your windshield survey, which is part of your community assessment, you're going to be looking for homeless, for those vulnerable populations. And you see that your chapters are 32 through 38 in Stanhope and Lancaster that can help you with that. Anything else, Penny, I need to cover on vulnerable? It's mostly from the book and internet sources. Your community assessment. How are you going to turn in your community assessment? What's going to be your final project? A formal paper. Can I get a woohoo? I don't think so. It is a group paper. Okay? So somebody's going to be responsible for collecting all of the parts and putting together your part. When you send it to the person putting it all together, needs to be APA. Okay? You will get the opportunity to work in a group. Do you have any questions so far? Okay. Go look at the content notes tab. This content notes I have built. This is how your notebook should look. Remember, you got the tab that's got your overview, and you got your tab that has the calendar, and then these are the assignments. And if you click on community as a client, let me watch them faint. That's resources, that's information that will help you. Because remember, there's several different learning styles in here. Some of you are going to read every word of the book. Some of you want some bullet points. Some of you want some video. Some of you want to look up your own information on the web. There's all kinds of information. And when you assess your community, you'll be doing it in the form of a windshield survey to go out, and it'll guide you through the information and the things that you're looking at. And so that's going to be in there, and then the directions on what all you need to cover, and a rubric. Remember, every assignment, you're going to have a rubric that shows you how many points everything is worth. Your leadership has a paper that's individual. This is a group paper, so it's a little longer for the same amount of points because you have 15 people working on this one paper. Okay? Any questions? Okay.
It doesn't matter. Hello, I'm Rosemary Markle. This course that I'm coordinating is going to be NU 467. Okay? And here is your book. If you have not purchased the book yet, pardon me, my voice has got a frog today. You need to get it. This is the 8th edition. You may have the 7th edition. If you do, that's okay, but know that the page numbers are going to be different. Okay, so if you've got the 7th edition, pay close attention to your page numbers. Miss Van Zant asked today that if you go upstairs and check in with your advisor, and that will count as one of your contacts for the semester. How many times a semester are you supposed to talk to your advisor? 3 times. Okay, so you can knock one of those out today if you'll go on up and do that. Okay, here's our course, 467. It's Leadership and Management. How many of y'all are in management now? Okay, we got a couple of people that are. Well, this is going to assist you in decision making. For the ones of you that are not in management, you're going to be able to go back to your workplace and sort of evaluate how your leader or your manager operates. Okay? What kind of leader are they? What kind of manager are they? One thing, I'm sorry, that I wanted to talk to you about is professionalism. This is going to be considered your professionalism course. When you call us, you need to act professionally. I can't tell you how many times I pick up the phone and y'all just start talking. And so I just have to stop you and say, let's start over. What is your name? What course are you calling about? How can I help you? Okay? So you need to learn to identify yourself. When you call a physician, you just don't start talking, I hope. I hope you identify yourself and say, I'm on 3 South, and I'm calling about patient in room so-and-so that is your patient, and this is the problem. Okay? So you need to get in the habit of, when you do communicate, to do that professionally. How many of y'all want to go on in nursing to a higher level? Several of you do. Okay? So you're going to have to know how to communicate with professional people. Okay? So we got that knocked out of the way. Leanne Puckett, she's at the back, is my co-coordinator in this course. So if you can't get me, you can get her. How many of you have your phone set up where you get messages on your phone from us? There is a way to do that, y'all, and you will never miss a message if you will do that. Set up Blackboard on your phone. Okay, it's a free app. And every time we put a message out there in whatever course it is, it'll pop up on your phone like that. Okay? So that every 24 hours you have read your messages, okay, because you've seen it on your phone. Okay. We got the announcement page first, and I'll just go ahead and go there. And I'd put a welcome out there for you. We're here Monday through Friday, 8 to 5. Okay? Call us. Our phones it's really funny because our phones get really busy at noon. I know y'all are going on your lunch break or whatever, and our phones will start ringing, but that's okay because we want to talk to you and we want to help you. But we do check our email, our messages before we go to bed at night, okay? But after 10 o'clock, you're probably not going to hear from us, okay? So don't wait till the last minute if you've got a question, okay? You can send us questions in the message center, and we'll respond back to you. Has anybody here not got a response from an instructor in 24 hours? Anybody? Not one person raised their hand, okay? And that's one thing we promote in this program is our availability to the students. You will not see that in all online programs. So if you're going to higher nursing education, you need to think about that. What is their history? Are they available to me? Okay. All right, let's go to assignments. That's what y'all are really interested in. We have the course calendar up here. I think every course we put the course calendar, and go under course calendar tab first. Okay. All right, you're going to see the comprehensive calendar. A lot of you, how many of y'all printed that off? A bunch of you have. We color-coded it to try to make it sort of easy so you can look and see what color, what course is, and when you have something due. Then click on the course calendar. Okay, these are all the assignments that you have this semester in this course. They are all open right now. So that if you have time that you can work on something, you can jump in there and start working on it. The Sigma Theta Tau, we put that out there. So some of you, how many of y'all got those done? Okay, 1 or 2 of you do. That's good. Okay, some of the assignments are going to be individual. Some of them are going to be groups of 3 or 4, self-select groups, so that you have coworkers you work with and y'all want to work on something together. You can do that. Then we have an individual paper on shared governance. Now, the assignments this semester are not going to be the same that your coworker that just finished this program had. Okay? So don't count on using their work. Okay? We have changed some of the case studies from the book. So that's why you got to have a book, because you got to go in and read the case studies. It's things like you've got an LPN and her work performance has been stellar. She's done a great job for you on your unit, and all of a sudden she starts coming in late. She starts calling in. How are you going to handle that? You've got an impaired nurse on your unit. What legally do you have to do? Okay? With the Board of Nursing, what legally do you have to do with your employer for the impaired nurse? So you're going to learn how to manage people and manage your unit. Okay? So that's very important information. I asked one of the nurse managers at the medical center that went through this program, I said, tell me what you thought about it. What did you think about the leadership course, the management course? And she said, I found it very stimulating. I learned so many things I didn't know. Okay? You're going to learn how to go about purchasing a piece of equipment. Let's say you want some kind of equipment on your unit. Okay? Well, you just can't call up to administration and say, I want to buy a piece of equipment. You've got to know how many patients it's going to serve. Is it going to produce any money for your unit? Okay. How often is the equipment going to be used? Okay. Those kind of things are what you're going to be learning. You have a paper to write. Have y'all heard that today already? One complaint that we've received from some of the master's programs is they cannot write. Okay? So we decided that it was part of our job to help you get there. Okay? So you're going to do a short paper, it's not long, on shared governance. Does anybody know what that is? Some of you do not. Some hospitals have it implemented, and it's where the unit-based nurse participates in decision making. She sits on committees. Okay? The shared governance is she brings to the table the view of the working nurse. And lots of times that will decide where they're going to change a policy or not. Okay? So it's on shared governance. Okay. Okay, close that out and go to the assignments. Y'all have a conceptual framework just like you did in Miss Walker's class. Click on the assignments. Okay, these are all the assignments, okay, that you have. Click on the shared governance paper, because that's really new. This is called a rubric. When you get in graduate school, you're going to be working off of rubrics. And we work off of rubrics here. It tells you everything that's got to be in that paper. Okay? If you don't have it, guess what? You're going to lose that point. So when I grade your paper, this is what I'm going by right here. So if you can't figure out how to get a running head on that paper, you better call somebody, because you're going to lose points. Okay? What we see is when we give you feedback on papers and things, then you don't come back and correct it, which makes us think you're not reading the feedback we're giving you. Some of y'all have lost the same points every time you've done a paper. Okay? So you got to, that's how we teach you, is in the feedback that we give you. Okay? So make sure you always look at that. Okay, close that out and go to information. Under information, we have given you a lot of helpful hints. Okay, for example, there is an APA YouTube video on how to set up a paper. I've last summer or summer before, I took a course. I went right there and I watched that thing. I made me some notes as I was watching it. Click on this for running head. Click on this for pagination of your paper. Click on this for, if you will do that, of course you got your APA book, okay? In it, you can see examples of papers. So when you get your paper set up, you could take your APA book, find a sample paper, and look at it and say, well, does mine look like that? If it doesn't, you got something wrong. Okay? One of the first assignments, you're going to have the option of going down to the state capitol to RN Day. Okay? That's January 20th. If you live in the Jackson area, I would advise you to do that. You have to dress professionally with a lab coat and your name pen. You can complete 1/3 of your assignment, of the first assignment, by doing that, by going. All those instructions are out there. The second and third part of that assignment is producing a resume. How many of y'all have a resume? Good. Okay, so what you're going to do, you're going to go in there and you're going to update your resume, submit that for us. The other thing you're going to do is write a business letter. How many of y'all have written business letters? A couple of you have, okay? I put a sample one out there, okay? So you got something to go by. And Dr. Cox has given y'all the table of hints for scholarly writing. I put those in there again, okay? So guess what you're going to be doing a lot of this semester? Writing, okay? Some of you have a real strong English background, and some of you do not. But you have tools to help you, okay? If you got a question about something, you can call in here, and we'll be glad to help you with it. That's pretty much it. You can read your own. Every assignment has instructions, okay? Make sure you read those before you even start working on it. But everything is open right now, okay? So if you decided you want to go home and knock that shared governance paper out, you could do that. At the bottom of the rubric on shared governance, I've given you a couple of websites that you could go to, and you can find some of your own, okay? It needs to be about nursing, okay? So when you type in your search bar, shared governance nursing, okay? Because that's what we're learning about. How does the nurse participate in that? We've given you several things to help you, and you can find some more. I found several articles on hospitals that have implemented it. That's a great one to use, okay? All right, any questions? You got the message center there, announcements, your course calendar is there. No discussion boards in this course this time. Okay? So your individual assignments are your ATIs, your paper, and your business letter and your resume. The group assignments are going to be 3 to 4, directing, controlling, and planning and organizing. Okay? All right. Any questions? Are y'all brain dead? Just about? Okay. Dr. Cox?
Y'all just thought you were through with scholarly writing, huh? I'm going to wait a few minutes for the other faculty to come down here because a lot of y'all got messages from DJ. You're in the wrong sections, and we need to get you to go. We're going to separate into different groups. The ones that had me, 10, 11, and 12 are going to stay in here, and the others are going to go with their faculty. So we need to get you with the right faculty, even if you're not changed your section yet, or else they'll tell you you'll get the wrong information about what we're going to do in research, okay? We'll go ahead and bring up we got it up there, okay.
Ms. Walker reminded me before we divide. 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 Those of you who do struggle with your writing, remember that there is the Writing Center on campus. The information about the Writing Center is in the RN to BSN resource, and they will take via email papers and give you feedback in terms of ways that you can improve those. So that is a resource that the W has available to you. If you have any additional questions, just see one of us afterwards, okay?
In that vein, I do want to say that you all made marked improvement over the semester last time. I know it was painful. I did ask you to save your papers with your comments and, have them for use this time where you could look at them before you start writing on your chapters and know the mistakes that you made so you won't make them this time. Unfortunately, some of you didn't read them along in the semester. I know it was going pretty fast, but as the others said, I'd be putting that same comment up there about the running head on a lot of people or on about the APA. And I know it's ticky, but we have had some feedback from the graduate programs, and we've been seeing an increase in that problem. I think that when a lot of people, I've got two grandsons that are in college now, 23 and 21, and they both said, I really should have paid more attention to that English class that I took in high school. And I was really glad that she gave me an A when I didn't do anything then. But I'm not too glad now because I don't know anything. And that was an experience a lot of people had. So we just took the task to help you correct that. All of you can. There's not anybody that is in this program, that has entered this program, that doesn't have the mental ability to bring themselves up to that level. And you don't want to be embarrassed when you go on to graduate school or even in your place of work, when you've got to write something up for your unit or, like Ms. Markle said, a new piece of equipment. You want it to be done properly, and you can do that. So try not to call us too many bad names, but we're going to hold to that same format we did when you had the last semester. Now, what we want to do right now, ladies, if you just come down here. We're going to divide you up before we start the orientation for the research class, 459. You should be in the same sections and with the same faculty you had last time. And I know that some of you all were caught in what I call the domino effect. Somebody who wasn't supposed to be in your course got in your course and filled up your course, and you couldn't get in it. You had to get in somebody else's course. But we need you now, regardless of where you are on Banner, to go with the same faculty that you had last time. So people who were in sections TE 10, 11, and 12 need to stay here with me, okay? And then people with Miss Lee, 7, 8, and 9 are going to go with Miss Lee. The people who are with Miss Hurd, 4, 5, and 6 are going to go with Miss Hurd. The people who are with Miss Ricks, 7, 8, and 9, 1, 2, 3 are going to go with Miss Ricks, okay? So the ones that are left here are going to be 10, 11, and 12. All of you should have all the books you need for this semester unless you're a returning student. If you are a returning student, you need to see your faculty person and find out if you have the right books or not. Okay, y'all, it's just us. All right. Let's go to information. I got somebody back there. Okay? Now, you need to make a notebook, just like you did last time. Print everything off. Hit the due dates, please, to open. All right, first thing you've got to do is a theory assignment on the 26th. That is the only individual assignment you'll have this semester besides your tests. Okay? Everything else is going to be group. You just did a theory assignment, so you could use the same resources. Remember, I put out some information about how to reference some of those online sites last semester, so hopefully you saved that. You've got a couple of new theorists to look at, but you're going to ask the same questions as it did last time. So you can knock that out right away. Now, as they said in the other courses, these assignments are all open now, but you cannot go ahead and do the research chapters anytime you want. This has got to be sequential. There's going to be, as soon as I get everybody in the right pew, I'll put out your group assignments just like I did last time. You're in your same groups. Your leaders are the same. But group 1 is going to write chapter 1 of the research. Now, that's not chapter 1 in the book. That's chapter 1 of the research, and it's called Introduction. You've got, you're going to write it. A group is going to critique it. You're going to do a final, just like you did with the bare bones, okay? I've posted the bare bones that I gave you at the end of last semester. I left out the terms to be defined because each group had a little bit different take on that, so you'll need to fill that in. When you go to write chapter 1, you're going to think, well, that's plagiarism if I take that from the bare bones. That's not plagiarism. That's your bare bones. It's for you to use. So when it asks you what is the hypothesis, put it exactly like it is in the bare bones. Don't make up a new one. Don't reinvent the wheel. Just go by that. About the only thing you're going to have to talk about a little bit about the importance to the profession. You're going to have to elaborate on that. But everything that is there, the title, the hypothesis, the null hypothesis, the problem statement, it's going to go into chapter 1, just like that. You've got a student example. Let's go back to the information, I think. Yeah. Let's see what all we got on here. Okay, let's see. Scroll down a little bit, please. Okay, go to content. Okay, click on sample research paper. Okay, this is a sample that some students gave us permission to use. It is not a perfect paper, but it is a pretty good paper for you to look at. So when you scroll down to chapter 1, there's the abstract you don't write now. People try to do that. The abstract's not done till the end, even though it appears at the beginning of the paper, so you'll do that next time. But you're going to start a table of contents, and then everybody that writes a chapter is going to add to that. And there's chapter 1, Introduction. So you can look at this and see how they have this set up. Sometimes if you have an example, you don't have to struggle quite so much. Now, I'm telling you, it's not perfect, so you don't need to copy it verbatim as the way they've set it up. They may have some APA errors in there, but you can see what goes into it, okay? You're going to start a reference sheet. I won't have her scroll down because it's clear at the end of the paper. This is a completed paper. You'll start a reference page. just like you did on some of your papers. And you're going to put your references in there you used in Chapter 1. The next group of people that's going to write Chapter 2, they're going to add their references on to that, okay? When you are through with your rough draft of whatever chapter your group is writing, you need to send that rough draft to me as your assignment, but you also need to send it to the group that's going to critique it. When they critique it, they're going to send it to me as their assignment, and they're going to send it back to you that wrote the rough draft. Don't start making your changes till you hear from me. The purpose of that is not to make your fellow students junior faculty, is to involve them in the process. And so if you have them, you start on their corrections, I might not agree with that, and you'll have to go back and relick that calf again. You don't want to do that. So just wait till you hear from me, and I'll get back with you in a timely fashion about the final corrections that you need to do. And we're going to follow that same process through the next 2 semesters. We're going to write chapters 1, 2, and 3 this semester. And we'll do 4, 5, and we'll do a PowerPoint presentation and the abstract in the summer. When you're through, you will have, for your own personal benefit, a completed research project from beginning to end with a PowerPoint. You can use that as an example when you go to the graduate program. You can use it in your place of work when you want to set up something. Perhaps you have a change in your units you want to do. You can do that then. So hopefully it's something that you will take with you. We're going to use our same topic we had last time, the suntan beds and the melanoma. And that's what we'll all be working on. Okay, let's go back to information again. Set you up a notebook. Research guidelines. You've got some very helpful hints about that. Notes. I wrote the notes. If you don't understand them, holler at me. Okay? They will lead you step by step through the process, and they'll give you examples. Click on the notes and let's open them just a minute. Okay, it's going to start with Chapter 1. Now, you know, I kind of tell a story as I do it, so if you get bored with that, just skip right along. But to me, research is like going to a foreign country. It's a language you don't understand, that you don't speak, and a direction you're not sure where you're headed. So we're going to talk about it like that in the notes, and I hope that won't be too boring for you. But it should spell it out to you. Now, Test 1 comes right from the book, but when you start with Test 2 and 3, it'll be a combination of the book and your notes. And we've got it posted on here, which chapters you read that come out of the book. There's a couple of items added to your APA this time. You're going to have to look at headings. You didn't have that before. And we'll have that put in the chart for you if we haven't already. Okay, go back to content. Okay, the bare bones is the bare bones you had last semester. We won't have to open that. Group assignments I haven't put in there yet because I'm trying to get everybody in the right pew. Critique of art, or how to critique student work, that's the same one you had before. You know, it's just the same example I brought forward. Critique of the articles for Chapter 2, that's the same one you had last time, critique of a research article. And the check-off sheet for your team leaders and team members, you don't have to turn it in again. We put it up there so people would be reminded of their responsibilities, okay? Let's see if we got anything else on that one. Scroll clear to the bottom for me. No, I think that's all. Okay, assignments. There's all of your assignments. Now you can see how the flow is. The rough draft of Chapter 1, critique of Chapter 1, final of chapter 1. You got a sample management plan back there on content, same as your management plan last time. So people know what they're supposed to do, when they're supposed to do it. Remember, if people don't participate, there's a part at the end of the grading sheet. For each chapter, you're going to have a grading sheet, just like you did for the bare bones. It's all broken down in the rubric. And there's a statement at the bottom. If somebody doesn't participate, you have to notify them as a leader. You have to try to get a hold of them, because I'm going to ask you that question. You can't just let them drop through the cracks. But if you have tried and they have not responded, they do not get the grade. And when you lose 125 points, it hurts your grade point really bad. So everybody needs to step up to the plate to get this done. But it's doable. You have plenty of time to complete each one. And I'm always available. You know that I'm not in the office but 2 days a week, Monday and Tuesday usually. But you can get me on my cell phone. I may be at the barn, may be at the church, but I'll be there and I'll call you back, or I'll talk to you right then if I can, okay? Because we'll make it a doable deal if you'll do your part. Okay, questions? Oh, we do have that YouTube video up there too on the APA site. There are a lot of YouTube videos about doing APA, but there is one site that the videos are done by APA. Don't get yourself sidetracked down somebody else's interpretation of that. The one that is posted with research is the YouTube video done by APA. But some of us are visual learners, and it helps us to see that. So if you have a question, you look at that, all right? Remember, that's what rough drafts are there for. But the cleaner the rough draft is, the less work you have to do to clean it up, okay? But now in research, it is meant so that if you do your part and you do what you're told to do on the critique, on my critique of the rough draft, you should get 100% of your points every time. But if you don't make the changes, you won't. But, grades are usually high in research. They're one or the other. They're high or they're down here because somebody didn't do what they were supposed to do or didn't participate in their group assignment. Questions? Okay, thank y'all.